Hey there, welcome back to the channel. Today, we're diving into something that might surprise you. And honestly, it's something most people don't think twice about until it's too late. You know that occasional itch you get on your skin? The kind you scratch once and forget about? Well, what if I told you that certain types of itching in very specific parts of your body could actually be your body's way of sending you an early warning? Now, before you get worried, this isn't about every little itch. But for adults over 60 especially, some recurring unexplained itches might not just be dry skin or irritation. They could be subtle signs pointing towards something more serious, like cancer. In this video, I'm going to walk you through 5 key areas where persistent itching has been linked with different types of cancer, sometimes even months before other symptoms show up. These aren't random spots. They're places doctors have seen time and again in patients who were later diagnosed with lymphoma, pancreatic cancer, breast cancer, and more. I'll explain why each area matters, what type of cancer it may be connected to, and how to tell the difference between a normal skin issue and something that needs attention. Most importantly, this isn't meant to scare you. It's about awareness. Because when it comes to health, the earlier you notice something off, the better your chances are of getting ahead of it. So, let's dive in. Sign 1. Itching. Between the shoulder blades. Now let's move to the upper back, right between the shoulder blades. This is another spot that often gets ignored. People blame their posture, dry air, or maybe a rough tag on their shirt. But for older adults, a deep, persistent itch in this exact area can sometimes point to pancreatic cancer. And here's the strange part. This itch often shows up long before any digestive issues or pain appear. How does the pancreas affect the skin on your back? Well, when tumors grow near the bile ducts, they can block the flow of bile from the liver. That causes bile salts to build up in the bloodstream, and those salts irritate nerve endings, especially in areas like the upper back. Linda, a woman in her 70s, described her itch as phantom-like. She'd wake up scratching every night, but nothing helped. Not lotions, not changing her mattress, not even back scratchers. It felt like it was coming from inside her body. When she finally went in for blood work due to fatigue, her liver enzymes were elevated. Scans eventually found a small tumor pressing on her bile duct. The key red flags here? A focused, unrelenting itch that doesn't improve with topical treatments. Especially if you also notice darker urine, pale stools, or unusual tiredness. Sign 2. Itching on the lower legs. Let's start with the lower legs, specifically the shins and calves. If you or someone you love is experiencing a constant itch down there, and there's no rash, no dryness, no new soap or detergent involved, it might be easy to chalk it up to aging skin. But here's the thing. This kind of persistent itch has shown up in many cases of blood-related cancers, especially lymphoma. And unlike dry skin, which usually improves with lotion, this itch lingers. Often it gets worse at night and doesn't respond to typical treatments. Why does this happen? Well, cancers like Hodgkin's lymphoma affect the immune system. As abnormal cells multiply in the lymphatic system, they release chemicals that travel through the bloodstream and irritate nerve endings, particularly in the lower limbs. So even though the skin looks normal, the nerves underneath are reacting. Take George, for example, a 75-year-old man who shared his story at a cancer awareness event. His only symptom for 6 months was an intense itch on the front of his legs. Doctors initially thought it was eczema or a reaction to laundry detergent, but after blood tests showed abnormal white cell levels and scans revealed swollen lymph nodes, they realized it was lymphoma. The takeaway here is simple. If you've had an unexplained itch on your legs for weeks, with no obvious cause and nothing seems to help, it's worth digging deeper, especially if you're also experiencing fatigue, weight loss, or night sweats. Sign 3. Itchy scalp without dandruff. Next up, the scalp. An itchy head might seem like no big deal. Maybe you tried a new shampoo or the air's gotten drier. But if the itch sticks around and there's no visible dandruff, flaking, or redness, it could be a sign of something deeper. Blood-related cancers like leukemia or even skin cancers on the scalp can present as a persistent tingling, burning, or crawling sensation, one that moves around and doesn't respond to anti-dandruff products or oils. Henry, a 73-year-old man, started feeling an itch on his scalp every afternoon. He changed shampoos, stopped wearing hats. Nothing worked. Eventually, a routine blood test for fatigue led to a diagnosis of chronic lymphocytic leukemia. What makes this type of itch stand out is its stubbornness. No cream helps. No product soothes it. And while leukemia isn't the only concern, skin cancers on the scalp, especially in thinning areas, can begin as a small, itchy patch. If it keeps showing up in the same spot and won't go away, it's worth getting checked by a dermatologist. Sign 4. Itching on the chest or breast area. Now let's talk about the chest, especially around the nipple or under the breast. Many women and men brush off an itch there as sweat, friction from clothing, or age-related dryness. But this area is one of the most overlooked when it comes to early cancer signs, especially inflammatory breast cancer or other tumors near the chest wall. This itch often appears before any lump. The skin might feel warm, tight, or rough, but just as often, it looks perfectly normal. And despite applying creams or lotions, the itch remains. Ruth, a 69-year-old woman, noticed a persistent itch around her right breast. She switched bras, tried new detergents, even went braless for a while. Nothing worked. Eventually, her doctor spotted slight dimpling in the skin and ordered further tests, which revealed a fast-growing tumor close to the surface. For men, this can be even easier to miss. Male breast cancer is rare but real and often goes undetected because the signs don't match what men expect. A small itchy patch near the nipple, thickened skin, or discomfort under the chest muscle should never be ignored, especially after 60. Also keep in mind that this kind of itch isn't always about the breast itself. It can also signal enlarged lymph nodes under the arm or collarbone, which could mean lymphoma or another nearby cancer. Sign 5. Persistent itching in the anal or genital area. Last, but definitely not least, anal or genital itching. Yes, it's an awkward topic, especially for older adults. But when this itch becomes chronic, with no clear cause like infection or hygiene changes, it could be signaling something serious. In some cases, it's an early sign of anal, vulvar, or penile cancer. Unfortunately, many people assume it's just dry skin, irritation from toilet paper, or even side effects from incontinence pads. Eugene, a 76-year-old man, dealt with what he thought was hemorrhoid irritation for nearly a year. He used creams, adjusted his diet, even tried cold compresses, but the itch stayed. Finally, a specialist ran a scope exam and found a small tumor in the anal canal. Had he waited longer, it could have grown silently without him ever knowing. For women, vulvar cancer can begin with a recurring itch on the outer genital area, sometimes with no lump, but possibly with rougher or discolored skin. Many assume it's hormonal or related to postmenopausal dryness, and sometimes it is. But if it worsens at night and doesn't respond to treatment, it's worth getting checked. This area is full of sensitive nerves, and it often sends early signals about internal changes. Whether it's skin cell changes, nerve inflammation, or swelling in nearby lymph nodes, chronic itching here shouldn't be ignored. All right, friends, as we wrap this up, I want to leave you with one powerful truth. Your body is always talking to you. Sometimes it speaks through pain, sometimes through fatigue, but often it starts with something small and easy to overlook, like an itch that won't quit. The 5 areas we talked about today, lower legs, upper back, scalp, chest, and genital region, aren't random. They're places where serious conditions, including certain cancers, often send their first silent signals. Now, none of this means every itch is a red flag. But for older adults especially, learning to listen to your body's quiet messages can make all the difference in catching something early. If anything we covered today sounded familiar, don't ignore it. Bring it up with your doctor. Ask questions. Start a conversation. You deserve clarity, peace of mind, and proactive care. Thank you so much for watching. We love hearing from you, so drop a comment below and to share one thing you learned today and how you plan to use it. Your stories inspire us and keep us going. If you enjoyed this video and found it helpful, please hit that like button, subscribe, and turn on notifications so you never miss a new one. Your support truly means the world. Thanks again for being here. We'll see you next time.